15-year journey for me to work on this concept. And then 8 years we've been working on it. Staff is working on it, making this bill better, and better. It's not perfect, but it's going to close so many loopholes. It's going to force healthcare providers to show you the price tag up front, not an estimate. It's going to show you the price up front. Think about this. You need an MRI of your knee. In one place, it might be $300. Another place, it might be $3,000, and it's the same care given at both places. A hip replacement might cost $15,000 one location and $80,000 in another. When families have $5,000, $7,000 deductible, price tags matter. So again, I just can't say enough how hard our staff has worked on this, and certainly just appreciate Senator Hickenlooper's efforts as well, and then all of our co-sponsors for bringing this across the finish line today. Thank you so much.
Thank you, Senator Marshall, and also thank you for staying within 2 minutes. I've had a light gavel to this date, Senator Collins, but I shall start trying to enforce the 2-minute rule, and starting, of course, with Hickenlooper.
Thank you, Mr. Chair and Ranking Member Sanders. For months, we've been working alongside Senator Marshall and his staff, Chairman Cassidy, Ranking Member Sanders, to push forward this Patients Deserve Price Tags Act. In 2025, Americans spent $5.7 trillion on health care. In the last 25 years, healthcare inflation has risen by 121%. That's 40% more than the cost of living has gone up. Too frequently, there's no way of knowing what you need to pay for medical care, what the cost is. Patients, often while sick or in severe pain, have the added mental anguish that comes from a totally dark, opaque system. The Journal of American Medical Association has estimated that about 25% of our healthcare spend is on administrative processes, pricing failures, waste, inefficiency. I mean, even assuming 10% of that is legitimate administrative costs, it provides the opportunity for hundreds of billions of dollars of savings. The gaming and confusion in our healthcare system drives people crazy, and we can put a stop to it. The lack of transparency in our healthcare system is the proverbial elephant in the room. It's almost unique among other services and goods that Americans pay for every day. No single company in this system is a monopoly, but without transparency, healthcare is an aggregated monopoly. This makes it almost impossible for people to make financially sound decisions about their health care. It hurts the 180 million Americans whose health insurance are sponsored by their employers, who they also don't have access to critical information. Even our nation's largest employers won't be able to see what they're paying for. 180 million Americans have amazing purchasing power. Let's be clear. Preliminary, nonpartisan economic consulting firms estimate $75 billion in additional tax revenue. Savings and reduction of costs would be dramatically more than that. And we need to ensure that Americans can seek medical care without the risk of being bankrupt. I will yield, but only after I thank Colin Goldfinch and Romney Crepado, Lily Ryan, Max Seltzer, patients' rights advocate, our own staffer, Hannah Berner, for all their time and effort to get this bill in tip-top shape. We know that there's a better future for healthcare, and sunlight is the best disinfectant.
Amen.
Thank you.
I yield back.
Senator Paul.
I commend the authors for their intentions on this. I think that it mistakes the problem for being transparency, and the problem is actually the prices are fixed. So if you're on Medicare, that's about half the people in the country, 45% of people on Medicare, and we tell you what the price is, and we make the hospital publish it everywhere. Does your price change? No, it's fixed. If you're on Medicaid and we force the hospital to publish the prices and all these things and we push it out there, is that going to change the price of Medicaid? No, the price is fixed. If we force the hospitals to put the price of your insured care out there and they do all the work and it's labeled everywhere, will the price of your insured care change? No, it's all fixed. There's only a very small amount of this market that cares about this, and these people don't have insurance. Once again, that's the true marketplace. I'm not saying it's a great thing, but in the true marketplace, people care. There are apps, and there are people beginning to ask that. I know at our local hospital, if you'll pay immediately towards either deductible or if you don't have insurance, you get a 25% discount. So I think people are aware of these problems, but I don't want people to think that this fixes the problem. When you mandate transparency on prices that are fixed, doesn't change the situation. The goal and what we need to try to strive to is where we have more patients that are in the situation where prices are fluctuating. Where prices are fixed, transparency won't help.
Would anyone else wish to speak? Okay, we will now move on to the S 4974, Making America's Food Safer Act. I thank Senator Tuberville for his work to advance food safety, giving the Food and Drug Administration the tools to better inspect food facilities and to respond to foodborne illnesses is essential for Americans to have access to safe foods. This bill also gives FDA the ability to destroy unsafe food at ports of entry. We have numerous examples of unsafe products, including radioactive seafood and illegal e-cigarettes entering the market without the ability to seize and destroy. I also thank Senator Marshall for his work on ingredient safety. Ensuring that what goes into our food is safe is also important to improve our own health, and I look forward to working with him on this in the future. We have a manager's amendment to S 4974. I move to adopt the manager's amendment in the nature of a substitute and have it considered original text for the purpose of the amendments. All those in favor, please say aye. Aye. All opposed, say nay. The ayes have it. The motion is agreed to. Do any members wish to speak on the bill?
Thank you, Mr. Chairman.
Senator Tuberville.
First, I'd like to thank Senator Kane on this. This is really important, especially those that have ports. You know, it's a common sense target approach. It modernizes our food safety system. It removes outdated statutory restrictions, allowing the FDA to leverage accredited third-party certificates programs data from both domestic and foreign facilities to prioritize inspections to help our supply chain. The bill grants FDA authority to immediately share vital, unredacted food safety data with state, local, and tribal and territorial health officials when public health is on the line. And finally, it grants the HHS Secretary authority to order the destruction of unsafe food imports that present a significant public health concern, preventing dangerous illegal products from simply turning around and re-entering supply chains while preserving full due process rights for owners. This is a bipartisan step forward for public health, supply chain efficiencies, and American farmers. Basically what this does is when bad food comes into our ports and it's turned around by our food inspectors, it goes right back out into the waters and goes to another port. And hopefully they get by with murder, so to speak. So we want to be able to destroy this food and not allow it into our country. So I urge my colleagues to support this bill.
I want to thank Senator Tuberville for roping me into working with him on this one. I very much appreciate this bill. I have a unique perspective